Hi, I'm Dr. Dipanwita Sen, based at Durgapur, consultant obstetrician and gynecologist. Today, I'm going to share a few aspects of breastfeeding with my patients, the pregnant moms, expecting moms, or moms who are already breastfeeding and finding it a bit challenging. So as you all know, once you are pregnant, your body and mind both are preparing to breastfeed. And there are certain hormonal changes that occur in the breasts, as a result of which there is increase in the amount and number of the breast milk producing glands, as well as the cells which will actually help in expressing the milk into the duct system, which are the tubal system. Now, why should you breastfeed? There are immense advantages for both mother and baby. As far as the mom is concerned, it helps her lose weight quickly. It helps in the involution of the uterus, which has to go back to the pre-pregnancy state. And it prevents her in the future from breast cancers, ovarian cancers, and endometrial cancer. Along with that, of course, it helps in bonding. Your bonding with your baby is different when you're breastfeeding than when you are not. As far as your baby is concerned, your baby is protected from infections such as the lung infections, the upper respiratory infections, from allergic asthma. As the breast milk has got the perfect constituents for the baby's brain and body growth, the baby is protected from childhood obesity. And in the future, of course, bonding, and as the baby grows, the baby will of course need additional food, but up to 6 months, this breast milk is the best and the most proportionate nutrition provider for the baby. Once you have delivered, the placenta comes out and there is a fall in the progesterone levels. Once the progesterone falls, there is a trigger in the brain which releases a hormone called prolactin, and this prolactin increases the production of the breast milk, and from the posterior pituitary another hormone called OXYTOCIN is released, which helps in the contraction of the myoepithelial cells, or the cells which will actually contract the glands and help in the expression of the milk into the duct system. So both of these coordinate, the glands as well as the contracting cells, both would work together and release the milk into the duct system, which will come out once the baby starts suckling. Now, when your baby is born, that is the time when the baby is most active, and that is the time when the baby should be latched onto the breast. Skin to skin contact would actually encourage the baby to suckle, because the baby is already used to suckling its own thumb in the womb, and now once the baby is out, the baby would take the breast nipple very easily if you are trying it straight away. Now, with practical constraints, like you might have had a cesarean section, you might be partly separated from your baby for a certain while you are recovering from the anesthesia, etc. There could be some hitches and some gap in the time in which you are able to put the baby to the breast. That sometimes might deter, but you have to have the frame of mind to get going straight away, and then it can start straight away. The first milk that you would get from the breast is called colostrum. Now, what does colostrum contain? It contains immunoglobulins. It is low in fat, and this immunoglobulin containing colostrum is extremely important because it coats the GI tract of the baby, and as a result of which prevents infections of the gastrointestinal tract. It does act as a laxative, as a result of which the meconium, which the baby should be passing in the first few days, comes out. So the baby is prevented from constipation also as soon as the baby is born. Now, after the colostrum is over, the breast milk proper starts flowing, and what you need to do at this stage is continue to suckle the baby, continue to put the baby to the breast. Now, the baby is not trained how to feed on the breast, so you have to know how to latch the baby. Now, what does latching mean? You have to allow the baby to open its mouth wide. The nipple, along with 2/3 of the areola, should go into the widely opened mouth of the baby, and the baby should actually be pressing with its jaws on the areola so that the reservoir of the milk will actually come out through the nipple. Now, see, look at the areola, and you will find there are certain glands called Montgomery glands, which will actually keep the nipple moist so that you don't get cracks and you don't get a sore nipple. But having said that, it almost always happens, and it is only because the baby is not latching properly to the breast. The baby may be sucking on the nipple, and that would make the nipple crack, the nipple sore, and you would feel too much of pain, and the baby wouldn't get the milk either. So neither of you would be happy. As the baby continues to suckle, the milk flow increases and the body actually gradually accommodates with the demand, and the supply comes out according to the demand. Initially, the baby's stomach is that of the size of a small grape, and then over the next few months it comes to the size of a small lemon. So mothers sometimes worry, am I able to breastfeed properly? Is my baby getting enough milk? So what you have to think, you have to be practical. If your baby is having a mouthful of milk, probably your baby is getting enough milk. If your baby is sleeping for a couple of hours after the milk intake, probably yes, the baby is getting enough milk. And about 6 to 8 times passing urine and passing stool a few times, and the baby is gaining weight, these are the few indicators that would help you to know whether your baby is getting enough milk. What next? Once you are getting used to this breastfeeding, you might have a sore nipple, a cracked nipple, and sometimes you may feel that you are not having enough sleep because it's almost a 24 hours thing where you are actually not getting enough sleep for yourself. So you have to take care of your own sleep as well. And in the first few days, the milk really may not come through in adequate quantities, and you might have to give some extra formula feeds. It's extremely important to maintain the baby's blood sugars, because low blood sugars is bad for baby's brain. So as long as you are satisfied the baby is actually not getting enough milk, if you are feeling the baby is not getting enough milk, it's quite okay to give extra formula feed, as long as you take care that you are doing proper sanitizing of your vessel that you are feeding the baby from, and you are taking clean water, well sanitized water. Now, there are a few questions that you might have, like if I eat this thing, my baby might actually get acidity, or my baby is actually getting acidity, or my baby is actually vomiting after the feed. Now, these are questions, these are very practical problems. If the baby is not able to judge its own appetite, the baby often would not be able to. So the baby would vigorously drink a lot of milk and then would actually puke out some. So you might feel the baby is not well. No, actually not. The baby is actually puking out extra milk. So that would be one. Second thing is, there are certain restrictions put on the mother. Sometimes mother is told to drink only certain gola bhat. It's like half-boiled rice or extra boiled rice. So she's not given certain types of feeds. But then it's extremely important for you to have a very balanced and variety of things to eat, because whatever you eat, the milk composition doesn't change. Maybe there is some flavoring, but that you don't have to be bothered about that. You can eat and drink whatever you feel like, as long as you are not getting sick with certain things, you are not getting acidity with certain things, you can actually eat whatever you feel like. Your health is extremely important. Finally, I would like to say that breastfeeding, you have to be extremely motivated. It is challenging, very emotionally demanding, can be very frustrating, but it's extremely rewarding too. You have to be physically fit, and mentally your hormones may do lots of different things. You might feel weepy, you might feel you're not being a good mom, and you're not being able to do enough for your baby. The cleaning, the keeping the baby in good condition, sometimes you might feel it is a big challenge. It is for a new mom, but then ask help from your professionals around, and if you have the intention to do it, you will definitely be able to do it, and we are there to help you. Goodbye for now.